Great to see you again. I know last time we chatted about your desire to address some concerns you had with your ears. I would love to hear from you, Melissa. When you look in the mirror or when you look at those photos of you, what is it that you notice that you wish to address?
I feel like this side especially is just like a little floppy.
Okay.
And I just want it back just a tad.
Uh-huh.
I kind of avoid pulling my hair up because it bothers me so much.
Okay.
And so especially this side, and I've kind of always had it, but I've noticed it more as I've grown up.
Got it. Well, you know, it's interesting. One thing that you highlighted, which is kind of natural for all of us, is to have one side slightly different than the other side. And so as you commented, you said kind of the right ear you noticed is a little bit more prominent when you look at it relative to the other side. And each ear is slightly different in shape and size. The reason the ear looks the way it does and maybe is a little more prominent is as follows. Firstly, if you look at the ear, there's a curve that should naturally occur in this area here. And as you can see, the curve looks really, really nice right here. But as it comes up into this area here where it sticks out a little bit more, we've lost a little bit of that curve. And when I do this, do you see how that curve just kind of comes right back? So there's a surgery, we call it an otoplasty, which is just a fancy way of describing changing the shape of the ear, where we make an incision that hides incredibly well behind the ear here. Through that incision, we can use some stitches to reshape this cartilage for you like that. Now, sometimes the ear is a little bit more prominent also because there's a little bit of excess cartilage in this area here because the cartilage is pushing away from the bone that's behind the ear. And in that instance, what we do also is we set back the ear a little bit. So now all of a sudden, you can see as we set this back a little bit and we reshape this ear here, now all of a sudden it doesn't stick out as much. So it's a combination of bringing the ear cartilage back to the bone behind the ear as well as reshaping it here. And we do it on the other side as well. And as you mentioned, this side here, and if we look at this side here, we notice that the loss of that curve is a little bit more noticeable on this side. That's why you see this side's a little bit more prominent or sticking out. So again, when we reshape it like this, you can see how that just kind of helps set it back. And again, setting it back to that bone behind the ear. So it's a combination of moving it back like that. And the cool thing about this surgery is it will allow you to wear your hair back. No one will see those incisions because they hide really nicely within the crease between the back of the ear and the and that bone in that area there. Now, we do the surgery at one of our 2 surgery centers here in Newport Beach. We have another surgery center in Beverly Hills. It's an outpatient surgery, meaning, as you know, as a nurse, that you'll be able to go home the same day. Now, after the surgery, you'll have a wrap dressing placed to kind of hold a little compression behind the ears. The following day, we'll have you remove that dressing. And in our instructions, it talks about getting some sort of a band, like almost like an athletic band, that helps protect the ears in this fashion here. Almost think of like a sweatband that you'll wear for a period of a week. Now you can take it off and put it back on as comfort allows, but you'll wear it for as much as you can for the first week. And then after that, you'll wear it for several weeks, about 4 weeks. When you're sleeping at night. Why? Because it's when you're sleeping at night that you may be tossing and turning, and if you toss, you might turn and pull the ear back like that. So just wearing that when you're sleeping at night following the surgery will be helpful as well. Questions for me?
I don't think so.
Okay.
I feel like I asked a lot last time.
Wonderful. Yeah, I think we talked about the risks, right? The risks are like, you know, infection, which is really quite low. One thing we also talked about is, and you can appreciate this as an ICU nurse, there is a specific bacteria that will try to infect the ear cartilage. It's called Pseudomonas. You're very familiar with Pseudomonas, I'm sure. And you also know that there's some antibiotics, the fluoroquinolones, that are really good for it, but you know there's some risks associated with that. So our end around that is this: if you can avoid getting this area wet for a few days after surgery, you'll decrease significantly that risk of Pseudomonas, and you'll decrease our need to give you something like ciprofloxacin. Further questions for me, hang out here. Jasmine, our surgery coordinator, she'll pop in.
Okay, thank you so much.
Good to see you again.
Good to see you too.
Thanks.